Hello, I'm Harriet. I'm the Research Coordinator for Inclusion Gloucestershire, and this video is to tell you about Inclusion Gloucestershire's Big Survey 2024. Inclusion Gloucestershire wanted to understand the areas of everyday life that are causing unhappiness for people in Gloucestershire who face disabling barriers. So we invited disabled people to give us their opinions and experiences, along with any ideas they have for improving things in 2024/2025. What did we do? We co-produced a survey with staff members from Inclusion Gloucestershire with lived experience of disabling barriers. The survey was then tested with our research advisory group, who also have lived experience. This is made up of 9 different people. The survey was then open for 14 weeks from October 2024 to February 2025. How many people told us what they think? We asked people about how happy they are in 17 areas of their life. 84 responses were received to the survey, and from this we identified the 3 areas that people are most unhappy about, which are mental health, discrimination, and leisure. Following on from this, 3 focus groups were held on these areas, and 30 people attended the focus groups in total. So we have a combined total of 114 people who gave us their views. Areas people are not happy about. We worked out the number of people in percentages who were either not too happy or not happy at all in each of the 17 areas. So the top 5 are mental health, where 40.5% of people were unhappy, discrimination, 39.3%, leisure, 34.5%, healthcare, 34.5%, and finances, 30.9%. Whilst the percentage of people who were unhappy may seem low, the comments made in the survey reflect very difficult experiences, which encourage us to do a deeper dive into these areas and hold focus groups. From analysing the data from both the survey and the focus groups, we came up with the following themes under mental health. Accessibility. People told us that there was a lack of face-to-face support, reasonable adjustments were not put in place, and there was a lack of available support based on where someone lived. Assumptions about what someone could do because of their disability was also a barrier, as well as the additional burden of getting to the service due to transport issues. Wait times. Participants experienced long wait times for mental health appointments, which exacerbated their mental health problems due to needing help in the moment with little accessible support offered in the meantime. Time-limited support. Therapy was often time-limited, with people on average having 6 sessions, which didn't feel like enough time to understand the person's situation and needs, and for the disabled person to gain trust with the therapist. Hard to reach. The process of getting a mental health related appointment and one that was suited to the person's needs was a particular challenge, with processes being complicated. Overlooked. When receiving mental health support, disabled people's mental health was overlooked by health professionals. Participants felt that professionals would only look at physical health or mental health separately. In some cases, physical health was the only focus, despite attending appointments for their mental health. Lack of support. People often felt unsupported when seeking help for their mental health and were only offered support if they were suicidal, with not enough support to prevent them from getting to that stage. Lack of understanding. There is a lack of understanding of disabilities and the health inequalities that disabled people face. This in turn highlighted that there is a lack of relevant services that are suitable and accessible for disabled people, particularly for people with chronic conditions and autistic people. Cost. The cost of some accessible therapies were not an option for disabled people due to not having spare money for this, with disability benefits not being sufficient to cover additional costs. Not person-centred. Support was not person-centred, with little attempt to understand people as individuals when receiving mental health support. And positive experiences. So positive experiences of having support from family members, private support, and medication. The second biggest issue for disabled people was discrimination, where the following themes were identified. Employment. Many people felt that they were treated differently in the workplace and were not considered or dismissed from jobs because of their disability. Physical access. There's a lack of physical access for wheelchair users due to pavements, drop curbs, potholes, doors in workplaces, shops, train ramps, and toilets, and this restricted access to activities, public transport, and other aspects of daily life. Attitudes. People's attitudes towards disabled people were identified as discriminatory through not directly talking to the person, making assumptions about what the person can do, being denied entry to places, and seeing disabled people as making excuses. Crime. Experiences of abuse, harassment, and being disbelieved. Healthcare. Discrimination within a healthcare setting from different health professionals, accessibility of language used, treatment, and not being taken seriously. The third biggest issue for disabled people was around accessing leisure activities, where the following themes were identified. Inaccessible activities. Accessibility of leisure activities was a barrier. Activities were not always physically accessible for the person's interests or were held in inaccessible older buildings, therefore excluding some disabled people from using them. Restrictions. Accessing leisure activities do not always feel like an option, with people feeling restricted as a result of their condition because of decreased energy levels, pain flare ups, and needing to prioritise energy. Transport impact. Transport limits how often someone can do an activity and when they can do it due to limited and expensive transport options. Cost. The cost of accessing activities is a barrier, with activities that require payment not being an option, the cost of getting to the activity and making sure support is there if needed. Lack of support. People found that they did not have enough support to access leisure activities and would need someone to go with them, which is not always possible. Adjusting. Participants felt that they had to adjust and accept what things they can do and are no longer able to do, with feelings of losing independence and confidence. Lack of facilities. There were a lack of leisure facilities available and accessible for disabled people in Gloucestershire, with not enough autism-friendly activities and information on what's available. On the basis of these findings, the following recommendations were made. Mental health. Services need to ask patients about the reasonable adjustments that they need to access mental health support and implement these. At the initial assessment, offer a phone or video call and ask the service user if any reasonable adjustments need to be made in order to access the service they need. Services should be able to provide the same level of support to all people through options such as providing a transport bursary, delivering online or phone appointments, home visits, or pop-up outreach clinics for people in more rural parts of the county. Awareness raising of the mental health needs of disabled people and those with long-term or chronic conditions. Hold annual reviews for people with multiple co-occurring health conditions so the patient and the GP have an opportunity to connect the dots and look at health holistically. Ensure that organisations are signposting to charities that may be more focused on the mental health need, which may have more scope for longer-term therapy. Provision of more longer-term talking therapy services that are accessible to disabled people. Autism training for mental health professionals. Training should cover autism-specific mental health needs, communication differences, coexisting conditions. Oliver McGowan training delivery by Inclusion Gloucestershire for mental health professionals. This includes the voices of those with lived experience in the training materials. It would be beneficial to have a mental health nurse in each surgery or an employed nurse specialist that can educate GP surgeries. Make people aware that they can refer themselves to talking therapy, such as NHS Talking Therapy Service, and share examples where disabled people have had good experiences of getting support from private mental health services. Introduce patient advocates in health settings to ensure that the disabled person's voice is heard. Interim support such as helplines, free private services or non-urgent mental health supports from the voluntary and community sector should be shared with people waiting for mental health support. And awareness of the mental health needs of carers of children with special educational needs and disabilities. Leisure. disability awareness training for bus drivers and other public-facing transport workers, and to include information on visible and invisible disabilities and some practical guidance around reasonable adjustments. Utilise travel training for people who may not be confident to travel on public transport alone. Promote and signpost groups and social hubs where people can feel less alone and receive support for worries. Signpost disabled people to free leisure activities. Promote the use of Fix My Street to report local issues like potholes and broken pavements, and look at the accessibility of the Fix My Street reporting portal/app. Signpost to inclusive leisure activities. Awareness raising for mental health and physical health practitioners that limited/restricted access to leisure activities has a significant effect on mental and physical health. Promotion of how to make leisure activities accessible to disabled people, and Gloucestershire County Council to consider supporting the cost and availability of accessible taxis. Promote accessible activity options with relevant service providers. Discrimination. Give employers the knowledge, understanding, and tools to make the recruitment process inclusive by design, by asking about reasonable adjustments ahead of an interview, making job adverts accessible, using plain language, and clearly stating that disabled applicants are welcome, offer phone or video applications and interviews, inquire whether reasonable adjustments are required in any way, provide questions in advance if requested, focus on the skills the job requires, support neurodivergent-friendly communication, include disabled people in designing recruitment and workplace inclusion policies, provide mentorship programs pairing disabled employees with experienced peers, and encourage flexible work styles that recognise different needs. Promote how inclusive recruitment works at Inclusion Gloucestershire. To reduce discrimination in the workplace, we need to make people aware about what true inclusivity means. For example, carefully choosing and designing a team-building activity so everyone has the same level of involvement. Give employees a better understanding of the law, their rights, and how they can constructively challenge instances of discrimination in the workplace. Promotion of the benefits and skills that autistic and neurodivergent people can bring to the workplace. Promotion of ways to make the workplace accessible for autistic and neurodivergent people, general public awareness regarding disabled people and those with mental health conditions, and share rights and avenues for complaints. General. Share this report directly with the people who took part and wanted to hear the results, along with appropriate supporting resources, and raise awareness with other disabled people via our website and social media, partnership and strategic organisations, and events and opportunities over the upcoming months. Raise awareness of the research findings with key decision makers in statutory organisations, including commissioners, health and social care, and relevant partnership boards, so they understand the context that disabled people are currently in. Identify current partnership and new potential partnerships that can develop work in these areas to support disabled people's concerns. Share the findings relating to access to mental health services when promoting our other research on talking therapies.